Hello friends, this is Hassan Nafid, your anatomy and physiology instructor at Madison College in Wisconsin. We're going to talk about the urinary system tonight. The urinary system is formed of the kidneys, the ureters, the bladder, and the urethra. It is a system that helps our body get rid of the nitrogenous waste products. It is also the system that helps our body regulate body water, helps our body control the pH. It also helps our red blood cells to mature. It is also the system that helps our body to control calcium metabolism. Let's go and take a look at the anatomy of the urinary system. There's two kidneys, right kidney and left kidney. The kidneys are located retroperitoneal. That means they are behind the parietal layer of the peritoneum. If you notice here, the right kidney is a little lower than the left kidney, and this is simply due to the presence of the liver on the right side. Kidneys extend from thoracic vertebra number 12 to lumbar vertebra number 3. So each kidney is on each side of the body. Each kidney is also surrounded by a renal capsule, and each kidney does have the suprarenal or two glands on top of each kidney. These are found on the superior pole of each kidney, and they are just anatomically different and functionally or physiologically different organs. They are part of the endocrine system. Turning the kidneys to the posterior surface, this is the anterior part of the body. I'm going to turn it around so I can show you the posterior part of the kidney, where you're going to find two ureters that come out of each kidney, and each ureter, one on each side, right and left, they open or empty into the posterior part of the urinary bladder. Each kidney, as we said, is surrounded by the capsule. This capsule is transparent and it is shiny. Around this capsule, the kidney is also embedded in the perirenal fat, and the outermost layer of the kidney is the renal fascia, and this is the outermost capsule, and it anchors the kidneys to the wall of the posterior abdominal wall. An adult kidney is about 5 inches long, 2.5 inches wide, and 1 inch thickness. So 1 inch, 2.5 inches, and 5 inches long. If you take a look at the interior structure of the kidney is divided into two regions. The outer region, which is exposed here, is known as the cortex, and the inner region is known as the medulla. If you also look at the kidney is thrown onto pyramids. These pyramids are found in the kidney, and each pyramid is further divided into smaller parts. Also, I wanted you to know that the medial side of the kidney, there is an indentation, that is a little depression here. It's known as the hilum, and this is where the structures come and leave the kidney. It does permit the artery, the renal artery, and the renal vein. And if I turn it around here, you're going to see the renal artery, the renal vein, and the ureter emerging from the hilum of the kidney. Each of the pyramid is separated by renal columns. If you see here, these are the pyramids, and they are separated by renal columns. Medial to the hilum here, you're going to see the renal pelvis, and this is a basin-like cavity. This renal pelvis will also receive urine from the major calyces. These are the major calyces, and the major calyces in turn receive urine from the minor calyces. So here we could identify the renal cortex, the medulla. In the medulla you're going to find the pyramids, you're going to find the renal columns. Also, this part is known as the renal papilla, which open into the minor calyces. Minor calyces will lead to major calyces, and the major calyces will open into the renal pelvis. The renal pelvis in turn will lead and form the ureter or the ureter, which drains urine into the urinary bladder. The functional unit of the kidney is known as the nephron, and nephrons are found in the kidney. There is about 1 million nephrons in each kidney. These nephrons will filter and will adjust the urine or the filtrate and push it in the renal tubules. We're going to talk about the nephrons, which are microscopic structures, in the next session in our kidney anatomy. Kidneys receive about more than 90% of the cardiac output per day, but only filters between 1 to 2 liters per day. It filtered in the calyces, drips into the pelvis, and down to the ureter, to the bladder to be expelled. Let's talk about the blood supply of the kidney. The kidney has a blood supply, an artery, and a vein, if I turn it this way, from the renal artery and the renal vein. Let's take a look at the branches of the renal artery and the renal veins. The renal artery enters the kidney through the hilum. It divides into the segmental artery. The segmental artery will lead and branch to the interlobar artery, and the interlobar artery and also the veins as well, so renal vein and renal artery, will divide into a segmental artery and a segmental vein. And these in turn, both of them will divide into interlobar artery and interlobar vein, and the interlobar artery and interlobar vein will divide into arcuate artery and arcuate vein. The arcuate artery and the arcuate vein, arcuate artery and arcuate vein, in turn will divide and give branches known as the cortical radiates vein and cortical radiates arteries. These are also known as the interlobar arteries. The cortical radiates and the interlobar arteries will give branches to the afferent arterioles and afferent venules, and these are the final tiny branches that will form the glomerulus along with the renal capsule and the filtration unit of the kidney. So to summarize, the urinary system is formed of 2 kidneys, one on each side, right and left, 2 ureters, right and left, the bladder, and the urethra, which opens into the exterior urethral meatus in the genital organs. Thank you for watching this video, and I'll see you next time.